Child maltreatment is an unfortunate reality occurring within Australia's community. The 2016 Personal Safety Survey reported 13% of Australian adults experience one or multiple forms of childhood abuse from a parent, guardian, educator, or non-familial person. In Australia, child maltreatment can be categorised into the following: physical abuse, emotional maltreatment, neglect, sexual abuse, and exposure to family violence. These subtypes include physical and verbal assaults with intent to inflict harm, emotional deprivation and neglect, failure to provide food, water, and basic essentials with malicious intent, and any sexual process beyond a child's understanding or contrary to community standards. Child maltreatment is universally recognised to have a direct correlation with multiple mental health disorders, physical health problems, and health risk behaviours throughout the victim's lifetime. Child maltreatment effects extend long past childhood. The Australian Bureau of Statistics found that adults who have suffered from abuse in their childhood were more likely to report lower levels of educational success, heightened levels of financial stress, and rate their overall health and mental well-being as poor. Under the Ambulance Service Act 1991, an authorised officer is permitted to protect any persons from danger or potential danger associated with an emergency situation. Under QAS policy, paramedics are not required to report any form of suspected child maltreatment. However, QAS CPM, which governs the profession, details that ambulance clinicians are encouraged to report a suspicion of harm associated with child abuse or neglect in the context of domestic family violence. If a paramedic deems that a child may require protection, clinicians can inform the Department of Children, Youth Justice and Multicultural Affairs. This section allows for a general action in response to child maltreatment, but does not explicitly mention paramedics. On the other hand, registered nurses and doctors are mentioned as mandated to report abuse, which can possibly result in the unintentional deterrent of mandatory reporting in the paramedic profession. The Criminal Code Act in 1899 authorises a paramedic to take reasonable measures to protect a person from any danger or potential danger within an emergency situation. Furthermore, a paramedic is allowed to disclose confidential information with sufficient professional interest in the individual's health and welfare. Each state has its own legislation specific to child and young adult treatment. The paramedic reporting process varies from state to state, with each state and territory having a threshold as to when reporting should take place. These legislations all share similar sentiment on the threshold for reporting potential harm, as has suffered or is likely to suffer significant harm due to absence of parental care, physical injury or abuse, sexual abuse, emotional abuse, psychological harm, or neglect. With these pieces of legislation and policies in place, paramedics throughout Australia have a basis to present reports and evidence in cases of suspected child abuse, neglect, or maltreatment. Under ideal conditions, children will be looked after, raised, and nourished by their parents. Having emotional, social, and psychological experiences and adaptations prepares children for associated social and academic interactions and activities. Child exposure to maltreatment or adverse experiences has been linked to negative health outcomes, including physical and psychological conditions, risk behaviours, and disruptions to normal childhood development. Increased attention and identification is crucial for practitioners to see early warning signs and provide appropriate intervention care for these patients. This opportunity not only can improve patient health and well-being, but it could also provide a reduction in future patient healthcare needs and costs. An Australian cost of illness study was conducted in 2012 to approximate the lifetime cost associated with child maltreatment. A sensitivity analysis, estimated 9.3 billion Australian dollars, was predicted in financial costs, which included health, welfare, criminal cost, and productivity losses. An estimated $17.4 billion accounted for reduced quality of life and premature mortality. Overseas, child maltreatment accounts for a serious worldwide economic burden. In the United States alone, a study was conducted in 2015 which estimated $428 billion in total non-financial losses. Advances have been made in the current understandings around child maltreatment, and serious long-term health-related consequences justify the need for increased attention on preventative strategies and intervention from early childhood. When responding to situations of abuse, a victim's circumstances must be considered. The victim's age, culture, language, disability, and sexual orientation should all be considered. The 6 steps for responding to abuse allegations that QAS suggests are as follows. Detection of abuse. This is the first step outlined by QAS and refers to the need to obtain a thorough history and a clinical assessment. Provide emotional support. Providing emotional support is important in regards to letting the victim tell their story. It is key for the victim to feel safe while doing this. Assess risk. Assessing risk refers to deciding what risk level a victim is categorised under. These include significant risk to patient health, risk of serious physical harm or potential self-harm. Safety planning. Safety planning is performed after a paramedic believes someone is at risk of harm or death. The paramedic should advise the victim of their concerns and contact QAS mental health liaison clinician and then report to QPS. Reporting. A paramedic officer can complete a report a suspected child in need of protection form, which can be completed online or over the phone. Documentation. This includes a thorough verbal handover and record the following details on the EARF. Information from either the patient or anyone on scene, details of the state of the environment, such as living conditions or the absentee carers, any information given to the patient in regards to support services, any recommendations for treatment and transportation to hospital, and any details that can cause suspicion of abuse. Human behaviour is the product of the environment. By implementing change from the core of the ambulance service, we can encourage an attitudinal change from reactive to proactive when it comes to protecting a child from maltreatment. By making reporting mandatory for all healthcare professionals in Queensland, we can increase the rates of identification of child maltreatment and raise awareness surrounding the issue. It is argued that the problem lies in the responses after reporting, not mandatory reporting itself. Lack of resourcing in the post-referral system leads to ineffective identification of valid cases. A follow-up study found that the implementation of mandatory reporting of child sexual abuse in Western Australia increased reporting by 370% compared to the pre-law period. Following these changes, education legislation can formalise the standards of action across the board for all paramedics in the service. Therefore, there won't be a reliance on personal moral values, which can differ between individuals. Having a streamlined reporting process integrated into the EARF and a dedicated referral system to review reports can greatly increase the quality of reports. Also, by integrating feedback into the system forms a closed-loop relationship whereby paramedics feel acknowledged and uplifted that actions are being taken as a result of their reporting. Risk versus benefit. Concerns of damaging the therapeutic relationship with patients due to reporting had been raised by paramedics. In the case of child maltreatment, many take a conservative approach. The tragic case of Victoria Climby, who was tortured by her caregivers and later died due to abuse and neglect, demonstrates that a conservative and reactive approach contributed to this tragedy. Paramedics bring healthcare to people's homes, which positions them advantageously as the first line of defence in preventing child maltreatment. Judging by the significant long-term health and economic costs of child maltreatment outlined previously, one can anticipate that the economic and social benefits would far outweigh the cost of this strategy.